Hello, everyone, and welcome to She Emerge podcast. Today, I will be sharing insights so that we can better understand cognitive behavior therapy. And these are practical insights that I want you to be able to walk away with. So, CBT, meaning cognitive behavior therapy. Cognitive behavior therapy is a short term therapeutic approach in which therapists, we're able to help our clients better understand thoughts, feelings, and behaviors that are seemingly attached to distress. So, allow me to help you understand that CBT is also evidence based, and working in the field, we have come across different successful experiences for clients as we work through with our clients their problematic presenting concern. Now, CBT helps to identify thoughts and also change in behavior. Now, when we think about thoughts in CBT approach, it plays a major role in the emotional and behavioral distress that individuals are faced with. Say, for instance, you have a friend who perhaps had called, and with this friend not being able to return your call, then this can also elicit feelings, perhaps irritation, anxiety, and this will, prolong the distress without understanding the meaning behind the friend not being able to return your call. So, what we want to be able to work with our clients is to understand the behaviors, which is part of the problem, and helping the client to understand the feeling that is attached to the friend, perhaps waiting to return your call. And then we want to be able to understand the situation that might be worsened as a result of this. So let's look at the connection between the situations, the thoughts, the feelings, and the behavior. So when we're looking at maladaptive thinking or perhaps behavioral patterns, we also note the distress that leads to this emotional situation. So if I have a client who perhaps accessed service, what does that therapeutic session look like? We want to be able to understand that with CBT approach, this session is structured where there's a clear plan for this session. Allow me to identify the different steps. One, within this session, we are focusing on the presenting concern and perhaps the distress that leads to this presenting concern. There is, however, a collaborative effort between the client and the therapist because they are working together to better understand, to better conceptualize, and to, reach in an actionable step, I want to say. So, one, it is structured. Two, we are focusing on the situation that is causing the distress. Three, it is a collaborative therapeutic approach. Four, it is skill building. When I say skill building, the client is now learning skills which can help him or her better deal with the distress within the therapeutic space and also between sessions. Now, I want to emphasize that thinking and behavior problems may be better able to worked through once the client is able to understand the event and also to understand what the belief is about that event. So, as the client is able to identify the thinking, which leads to him or her feeling distressed, different emotional cues may arise, irritability, annoyance, all of these emotions are attached as a result of the situation. And so, as I engage with couples, for instance, they're able to identify the thinking styles in terms of the miscommunication. They're able to have a better concept of each other. And once they're able to identify, the communication styles, for example, are they utilizing I statements as opposed to accusatory statements? You never, you should, you always. Once that has been done in their relationship, then defense mechanism will play out more frequently. So couples are able to identify the styles in which they are communicating, and they're better able to have a better concept of each other. Again, what I also notice is that couples are able to understand the underlying belief system in which is being incorporated in their relationship with each other. And depending on their love language, that also plays a huge role as well. So, as couples are able to identify their interactional styles, the patterns which are emoting as a result of the distress, they're able to look at actionable steps in practical ways in which they're able to look at the distress, the underlying belief that they have. And this has been helpful for couples as they continue to work through presenting concern. So, as I reiterated earlier, as it relates to CBT, we look at the person as in A, we look at the behavior. We also want to look at the cognitive distorted messages as well. So, as we are able to look at that, we want to be able to pay close attention to the behavior, understanding that thoughts, feelings, behaviors, they matter in how we are able to approach the different communication styles within the relational system. Now, if we're able to identify the patterns in the relationship, couples are able to better understand the distress, and very often they're able to work through what the situation is as opposed to labeling the person as part of the problem. Now, even so, as a marriage and family therapist, we know that uh, the person is not the problem, right? So the problem is the problem. And when clients are able to focus on the problem rather than the person as the problem, they can walk away with a better understanding of what their relationship, the context, they're better able to contextualize what's happening within the relational space. So, have we seen many success? Absolutely, yes. We have seen as therapists a lot of success when clients are able to better understand CBT in terms of when we think about cognitive, we're also thinking about cog, meaning the thought patterns. And the patterns very often are recurring patterns. So if they're able to identify those recurring patterns, then they're better able to have a context in which they're able to understand the context, rather than what causes these problems, if they're able to look at the context surrounding the issue, then the distress can be worked through because they're able to understand, the thoughts, the feelings, and they're able to separate the thoughts, feelings from the other. So even as I mentioned the other, I want to be able to say that when it comes to CBT, like I said, it is structured. Clients are given homework. They're able to practice these skill building techniques between sessions, and they are, reporting back to therapists in terms of how this plays out at home, what they have noticed, and in terms of that, how they're able to respond rather than react. And this has been useful for them to practice these CBT skill building techniques between sessions. So it points back to what I mentioned earlier, that these are evidence based. It is short term. It, works through very well with clients who are facing or navigating depression, anxiety, addiction. I've also worked with clients who are navigating substance abuse, and they're able to identify, the belief, the thoughts, the reoccurring patterns that they have noticed that causes the distress. And so once they're able to look at the presenting concern, the situation, as they work through therapy, perhaps between 8 to 12 sessions, then they can walk away with uh, coping skills. They have a better toolbox where they're able to pull out from their toolbox, and they're able to recognize, distressing situations. So guys, I hope something that I've said, you are able to glean from this, and you are able to have a better concept in terms of the connection between situations, thoughts, feelings, behavior. And so this essentially will help you to recognize maladaptive or behavioral patterns. And so therefore you are able to work through, lean into the space when you recognize this is part of your relational concerns, and you're able to work through this better with your partner, and not only in a couple setting but also with individuals and family. It has been proven that CBT is effective. So thank you again, and if you are able to reach out to a professional therapist, I would encourage you to do so that you can, get onto your wellness journey sooner than later. So thank you again. And if you have not yet subscribed, go ahead and subscribe, share this episode with a friend that you may think would benefit from this episode. So thanks again for joining. And I do appreciate you watching this episode in its entirety. Bye for now until the next podcast.